Good morning, everybody, and welcome to our webinar. Very much appreciate your time this morning. And I am coming at you from my phone because I'm having internet problems. Welcome to doing things with technology and virtually. But anyway, my name is John Richard. I'm Deputy State Superintendent with the Department of Education. And again, appreciate your time with us this morning. Along with me, I have Scott Hunt, who is our Executive Director of Field Relations. And maybe a few weeks ago, right after the kind of the new mapping system and everything that came out kind of county by county, we realized several people still had questions about understanding Ohio's health advisory system as it now stands. And so as a result of that, we thought we would just afford you the opportunity to hear directly from the Department of Health, and then we'll open it up to questions a little bit later on today. But without taking further time, I am going to turn it over to Brian Fowler from the Ohio Department of Health and a Chief Data Officer there. So Brian, I will turn it over to you. Thank you.
Great. Good morning, everybody. I'm going to pull up some websites so we can talk through this and show you where you can see everything for the Public Health Advisory System for yourself if you want to look at it later. Okay, so I'm going to start with all of our public health advisory information is on the coronavirus.ohio.gov website. That's also where we have all of our other coronavirus stuff, including dashboards that talk through lots of different factors related to COVID-19. So feel free to check that out if you'd like. But we're going to talk today about the Public Health Advisory System. And to get to that, you go to coronavirus.ohio.gov, which you see on your screen here, and then click on, up in the upper left corner, Ohio Public Health Advisory System. And that's going to take you to another page that will, when it loads here, we'll have a map of Ohio, and it shows you the current every county in the state on the left here with all the current different levels. You know, I think most people, if you've been following the news a little bit, are aware of the the red counties tend to be the ones that we're most concerned about, and the yellow counties are the ones that we're a little less concerned about. So you can see there on the left what that looks like as of Thursday of last week. One thing I will say is we release a new update to this every week on Thursdays at 2:30 p.m. And the goal of this is just to sort of level set with everybody of what we were trying to do with this. It's really designed to give people in across the state and local officials that are making decisions, superintendents, whoever else, local government officials, some information on the COVID-19 activity in their county. And when I say COVID-19 activity, what I'm talking about is either in these counties we're most concerned about, the red counties, those are the ones that we're seeing a rapid increase in cases, or we're seeing a sustained high level of cases and transmission in that particular county. And so that's what it was designed for. There are currently no statewide policies tied to the advisory system. It's essentially, think of it like almost like a weather forecast, where these are the areas that we're most concerned are going to have, say a thunderstorm or a tornado or something like that. So there's certainly no, at this point, there are no policies tied to it. And early on, when we first released the system, we did have a mask order tied to the red counties, red or above, because there's also a purple category. We'll get to that in a minute. Nobody's reached that yet, and hopefully we never do. But there was a mask order tied to the red counties initially, and then that, as everybody knows, went statewide. So with that, I'm going to jump into the how these levels are calculated, and bear with me a little bit. It's a little detailed, so I will do my best to go through it, and of course we'll have some questions, time for questions at the end. So basically this is tied to there are 7 indicators currently, and depending on how many of these indicators you meet, that tells you what level you're at. So if you meet no indicators or 1 indicator, you're going to be yellow. If you're 2 indicators or 3 indicators, you're orange. If you're 4 or 5 indicators, you're red. And it gets a little more complicated when you get to the 6th and 7th indicator. If you meet 6 or 7, you're red the first week you meet 6 or 7, and then you move to purple the second week you meet 6 or 7. So it has to be 2 weeks in a row. And we did that because there's some fluctuation in the data. And we want to take a county to the purple level, which is the highest level of this system. We wanted to make sure that the data was stable enough for a 2-week period to show that, yeah, this county really is reaching that level. So now I'm going to dive into these 7 different indicators, and on this screen you should be able to see on the right side of the screen there are 7 different boxes. There's sort of 6 smaller ones and 1 larger one, and so each one of these represents an indicator. So up in the left corner here, indicator number 1 says new cases per capita. And just so you know, we're on Franklin County right now. And you can actually go back and look at different dates. And these, that goes back to the 7th or July 30th, but we're on the 20th right now because that was last Thursday. So this first indicator is the number of new cases per capita, and the reason we do it per capita is because we want to make sure that we're comparing counties appropriately, because every county has a different population, and so the per capita is actually the number of cases per 100,000 residents over a 2-week period. That's what that number means. So in Franklin County, there were 1,440 cases over the last 2 weeks. County population is here if you're interested, and then that gives a case rate of 109.36. So basically, that's how many cases per 100,000 individuals over that 2-week period occurred. So that one's pretty straightforward. Now, one thing I want to mention about this particular indicator is it's the most important indicator that we have, because there's a couple of other things tied to it. So if you reach the red status, the level, what we call level 3 or red, so Franklin County is actually one of them. If you have this rate at over 100, which Franklin County currently is at 109.36, then you cannot drop back below red until that number drops below 100, as I mentioned. And the reason for that is most of these indicators are set to flag when there's a big increase in cases, and if the increase slows but it plateaus at a high level, we still want to keep those counties in the red category, because there's still a lot of COVID-19 activity and transmission occurring. So that's one thing that I'll mention. And on the other side of that, if it's less than 10, which 10 cases per 100,000, and I think we might have one county like that. I think it's Noble County. No, actually they're not anymore, but they used to be under 10. So if you're under 10, then you're automatically a yellow county. So that one's sort of like that indicator can supersede everything else. So that's probably the most complicated indicator of them all. So the rest should go more quickly. let me jump back to another county to sort of illustrate. So Cuyahoga here is a good example of a county that had been red previously and has now dropped back to orange because they've dropped back below 100 cases per 100,000. Okay, so moving on to indicator number 2. This has to do with new cases and whether there's an increase in new cases in this time frame, which is actually 3 weeks on this indicator. And as you can see on this one, Cuyahoga County has seen a decline in cases. There are other counties that have seen increases. I think probably Mercer is probably a good example of that. No, that one didn't flag actually. But if it flags in, if there's an increase, you'll see a yellow line here. So if I go back to Franklin, because I saw that on another indicator. Yeah, here, we're not to indicator 4 yet, but if there had been an increase in this new cases, it would show as yellow on this little chart. So this new case thing, basically what this means is you have to have an increase in cases over, it has to be over a 5-day period. And this is actually done as a 7-day average. So that might be a little confusing for some, but basically what that means is you take today's number, you add it to all the numbers for the past 6 days, and you divide it by 7. So it's the average number of cases each day over the last 7 days. And that we do that to smooth out the variability in the data so it's not jumping up and down. So that's indicator number 2. Indicator number 3 has to do with congregate settings. And congregate settings, for those that aren't familiar, are basically places where people may be living in more confined spaces. And so for this indicator, we define that because of the way we track this data as there's 3 different categories. One is prison, so incarcerated individuals are included in the congregate setting category. The other is group home settings. And the third is the long-term care facilities. The majority of long-term care facilities are nursing homes, but there are some other categories of those types of facilities. So the way this measure works is if more than 50% of your cases in your county are not in a congregate setting, then you flag this measure. This measure is met. And so, for example, here in Franklin County, you can see that the numbers are much higher. You know, the week prior was about 90%, before that 95, and 97% the 3 weeks back. So what that's telling us is that there's most of the transmission of disease in Franklin County is in the community, not in these congregate settings. And so this is designed to prevent, you know, Marion County is a good example of that, when the prison outbreak occurred a couple of months back. I think it was in April, where there was a huge outbreak in the prison, but it didn't spread out into the community. So there's less concern for the community, but there's a big concern for the prison itself. And there's also a concern that it might spread into the community. But if you can control an outbreak within those settings and not let it spread, then that's a good thing, and it's less risky for the community. And so that's why that measure is in here, indicator is in here. Moving on to indicator number 4, which is emergency department visits. This is another one that's very similar to indicator number 2, with increasing cases. This one is increasing emergency department visits for COVID-19, both symptoms and confirmed and suspected cases. So it's anybody that's going into the emergency department and presenting with symptoms, or they're diagnosed. And so this is a measure of, it's one of the earliest indicators we have of if anything is going on. And the reason I say that is most of the data that we get for cases can lag by several days and even weeks in some situations, because you have well, first of all, there's multiple factors, but first of all, if somebody starts developing symptoms, it may take them a couple of days or even a week to develop severe enough symptoms to seek out care. Once they seek out care, it may take a few days to get the laboratory results back, and then maybe another day or two to process through the public health system to be counted as a case. And so you can have a lag in this reporting. So the emergency department visits is actually something that we get in real time or near real time from most hospitals in Ohio. And so it's something that we can look at pretty much any hour of any day and see what's going on. So in this case, you have you see there was an increase. This is this yellow area here in emergency department visits. Now, of course, there was a decline and then it leveled off and it's starting to go back up again. So that going back up has flagged this indicator. That's why it says met up here. Moving on to indicator number 5, same concept, but this is outpatient visits. So visits to doctor's offices. So if you're seeing, and this is for not symptoms, this has to be a diagnosis. So if you're in your particular county, if you have increasing visits to outpatient providers, you'll see this yellow like on number 4, but it would be on number 5 if it's over a 5-day period, and then that indicator will be met. And then number 6 has to do with hospital admissions. Actually, the last 2 indicators have to do with hospitals themselves. This indicator 6 is about new hospital admissions. So it's the number of new people per day going into the hospital, and it's also a 7-day average, like the last few I've talked about, 7-day moving average. And so if you have increases over a 5-day period of hospitalizations, this indicator is going to flag. And as you can see in Franklin County, that has been steadily dropping for the past 3 weeks, which is a good thing. And then the final indicator, number 7, has to do with hospital capacity. And this one, there are actually 2 different pieces of it. The first piece is looking at ICU or intensive care unit capacity or occupancy, and the second part of it has to do with what the percentage of that occupancy has to deal with the actual COVID patients. So, for example, this you can see here on August, the one we ran for August 15th. The ICU was actually 77.99%. So that basically what that means is that in well, I should back up a little bit on this one. This is the only indicator that is done at the regional level. So in this case, the reason we do this at the regional level is because there's hospital bed capacity in different, all across a different region. So it's not important. Well, it's a little bit important, but it's not as important. For example, if all of the ICU beds in Delaware County, which neighbors Franklin County, are full, if it's easy to transfer patients to Franklin County, which has lots of additional capacity. And so we do this at the regional level, and there's public health planning regions. They correspond to the different parts of the state. There's a central region, northwest, northeast, southwest, southeast, those kind of general regions, and they tend to coalesce around our urban centers. But what this one's telling us is that on August 15th, almost 78% of the ICU beds in in the central region, which includes Franklin County, were full. But what it's also saying is in this little darker blue area that 8.84% of those beds were occupied by COVID-19 patients. So in order for this one to flag, both this lighter blue has to go over 80%, and the darker blue, which is the COVID portion, has to go over 20%. So we're nowhere near that in Franklin or in the central region right now, and nowhere else in the state either. So this one to get this one to flag, you'd have to have a lot more patients going into the hospital. So you'd see this line going up a lot more instead of down. Okay, so I think I have gone through each of the indicators. I'm going to pause here and turn it back over and see if there are any questions or any additional information that the Department of Education would like to provide.
So we'll open it up for questions, and I posted an announcement in the chat box. It will be easier to facilitate. If you can post your question in the chat box, then we'll deliver that to Brian and ask him to reply. So we'll give you a moment to do that. We'll give you a little wait time here.
And Scott, while you're doing that, I think the other thing that we'll mention is, while there is not a requirement per se in terms of, if a county's red, you have to close your schools. We think as most of you and most districts across the state or schools across the state have looked at what that means to be red, and especially if it's red and increasing, I think most of you are taking a cautious approach, and that is when you're going mostly or all remote at that point. That certainly is in line with kind of the warning system itself. But to be clear, there's not necessarily a requirement. Now, in working with your local health departments as well, they are looking again at this same system. And in working with you, that is, I believe, is where most of them are falling out on this as to whether or not you should close. So anyway, just wanted to make that bit of a distinction as well. So with that, I'll turn it back over to Scott to monitor the chat. Scott, I think you're still on mute.
Yes, I was. Thank you, John. Brian, is it possible to get the information about cases by zip code?
So in the public health advisory system itself, we can only do this at the county level because many of the indicators that we look at, the data is only available at the county level. In terms of case information, that is not something that we have. So outside of the public health advisory system, that is not something we've done to release it at the zip code level. However, most local health departments have done so. If you go to your local health department's website, it's very likely that they have already published that information out. You can also get that directly from your local health department if you reach out to them in most cases.
Thanks, Brian. Here's another one. Will being designated as purple mean that all schools in that county will have to close their campuses?
So there are no policies tied to the advisory system at the current time, and there is no, as far as I know, any discussion of making that determination if that occurs at this time.
And this is John. I think what I would add to that is that as I've spoken to numerous superintendents across the state in working with their LHDs, their local health departments, I do think we're finding that seems to be the direction. And again, kind of going back to the red and purple designations, it seems as if most of those LHDs, especially if the numbers are increasing once in the red, and my guess is it would probably hold true in the purple, that they're going to, at the local level, probably make that recommendation to you as a district. Not sure if they would do that as a requirement, but my guess is it would be very strongly advised at that point. Again, that's based on my observation and conversation with most of you and some of the LHD leaders as well.
Okay, we do have a few more minutes and not capturing any additional questions at this point, so we can give it a few seconds here to see if anything else pops in.
And while you're waiting for that, Scott, the other thing I'll say is Scott and I are both very accessible. Both of us have been kind of at the forefront of this from the Department of Education's standpoint, and we have been in almost weekly, if not more often, communication with the Department of Health. They have been a great partner with us. And if you do have questions, we can either get you to the right people or we can get the right answers back to you from the Department of Health as well. Anything else, Scott?
Yeah, a couple coming in here. So let me get to those. So for the first indicator, is the number confirmed cases or does it include probable cases?
That's a good question. It does include confirmed and probable cases. Just for reference, about 5 to 7% of our cases tend to be probable cases. The vast majority, over 90% are confirmed. One thing I did not mention is that measure in particular, the first and the second measure, do exclude incarcerated individuals. So if you're in a county that has a large prison or something, or basically if you have a large prison, those numbers would not be included in that.
And just in addition to indicator one, is this the indicator that the governor uses during his press conference? Is that what he's referring to?
When so he uses sometimes different things, but he's generally using that particular one when he talks about cases per capita. So for example, yesterday he did include the numbers for all the counties' cases per capita, so yes.
Okay, and what factors are local public health districts using to recommend moving to a remote setting?
I'm not sure I'd be the right person to answer that, but I think in general, I could say, looking at the data, which we've made accessible to everybody on our website, and the local health departments have access to more detailed data, obviously, because they're the ones that collect a lot of this data for us, and so they have data all the way down to the individual level. So it's really looking at a lot of different things. Most of it we've captured in this public health advisory system. And so those are the factors in terms of, you could also look at different age groups. Is it spreading among the younger population or is it more in the older population and those sorts of things. So there are lots of factors at play into making those recommendations.
And I would say this is typically going to be a local school district along with their health department decision, and it's probably going to look different from school district to school district, where one might be recommended to go remote and others might be looking at the data a little differently, and they may recommend to stay in the model that they're currently using.
That's correct, yes.
Okay, with that, it is 11 o'clock. We promised to keep this to 30 minutes, which we're right there. Brian, any closing comments from your vantage point?
All I'd say is, keep looking at this data. We have it come out every Thursday, and I know you guys have tough decisions to make locally on all this. Do our best to inform those decisions as the best that we can. So appreciate it.
Well, Brian, on behalf of everybody on the call and certainly your partners here at the Department of Education, we appreciate your time today. Thank you for kind of better informing all of us. For those of you who are listening in, just prior to closing, I want to say thanks to Scott Hunt for being part of this today as well. And also encourage all of you, if you're not already best friends with your local health department, you should be best friends really soon. And secondly, if you do have a unique situation that comes out or comes up in your district or your school, again, feel free to reach out to Scott or me, either one, and we can kind of coordinate your questions and, as I said, do our best to get them answered. With that, thanks again for your time, everyone, and best of luck as you begin the new school year. Thank you.